Good morning, everybody, and welcome everybody to today's webinar on mindfulness with Sarah Bojakowski. Sarah is a mindfulness teacher and she runs mindfulness courses across Hertfordshire, the Mindfulness in Schools programme, and she also delivers in a range of ways to adults, including one-to-one sessions. This introduction to mindfulness for chronic illness and pain management will be an hour and a half session. The first 30 to 40 minutes approximately will be around Sarah's presentation. Then we will have a 30 to 40 minute mindfulness session, followed by time for questions and answers. So please do use that question and answer facility on your device. If you're joining us from a laptop or a PC, if you take your cursor down to the bottom of the screen, a little row of information should come up. One of those should say question and answer. If you're joining on a tablet or a phone, if you tap the screen, top left or top right should give you the question and answer button. So please do pose your questions through there for the end of the session, and I will be posing those questions to Sarah. Please do ensure that you are in a quiet space, hopefully not going to be too disturbed, and make sure you're very comfortable, sitting or lying, whatever's more comfortable for you for the second half of the session when we will go into mindfulness. If you do drop out of the session, please just click the link and join back in. If something happens with Sarah's internet and she drops off for whatever reason, please just sit and be patient and we will let her back in and the session will continue. So that's all from me. I will now hand you over to Sarah Bojakowski. Thank you very much.
Thank you, Nikki. So welcome everybody. Thank you all for joining today. I hope you're going to find this session really informative and helpful, and even maybe a little bit relaxing. So I just thought I'd introduce myself before we start. So my name is Sarah, as Nikki's already said. I'm a qualified mindfulness teacher, and I teach mindfulness-based cognitive therapy and mindfulness for everyday living. Now, I came to mindfulness years ago when I first received my diagnosis of a chronic illness. So I was diagnosed with lupus quite a few years ago now, which is a connective tissue disorder. And I was recommended to try mindfulness to help me manage the way I felt about it and the symptoms I was having and the stress I felt around it as well. So I went along to an 8-week mindfulness course, which was at the time a pilot for the NHS. And I completed my 8 weeks course. And over the course of those 8 weeks, I realised that actually this was really beginning to help me. And I loved it so much, I could notice the benefits for myself long term. As well as managing my stress and anxiety, it helped me sort of manage physically how I felt as well. So I went on a few years later to train to be a mindfulness teacher. So I undertook a year of study at the Oxford University Mindfulness Centre, and I've been teaching and practicing mindfulness ever since. So I'm also teaching mindfulness in schools at the moment to young people, and that's really great too. So I'm really pleased to be here with you today to share some of what I've learned and hopefully give you a little bit of insight onto how mindfulness may be able to benefit you. So for the next sort of, 20 minutes, half an hour or so, I'm going to be sharing a presentation with you just to explain to you a little bit more and give you something to look at other than me. So let's move on with with this presentation. So what we're going to be doing just this morning is just to have a think about what mindfulness is. And what the benefits of mindfulness are in general. And then we'll be looking more specifically about how it can help with chronic illness and pain management. And then if you're happy to, we're going to have a go at a body scan strategy, which is a wonderful mindfulness practice and particularly helpful for those of us that are suffering with pain or discomfort. And then having a bit of a think about how you can implement this into your lives going forward before all your sort of questions and answers at the end. So I hope that's what you were all expecting. So let's have a think then what mindfulness is. So mindfulness really is all about paying attention on purpose in the present moment. So it involves learning to direct our attention to experiences as they happen in the moment, moment by moment. So this moment now and then this moment now, if that makes sense to you. And it's about having an open mind to what we find and acceptance. So rather than worrying about what's happened in the past or spending time thinking or worrying about what might happen in the future, mindfulness trains us to kind of respond a bit more skillfully to what's actually happening right now, whether that's good or bad, but it helps us to be in the moment now and out of our heads in that sort of worrying or ruminating sort of mode. So it includes paying close attention to our thoughts, all the things that are going on in our heads, in our mind, our busy minds, and paying attention to our emotions and feelings inside our bodies, as well as physical sensations, as well as to noticing what's happening in the outside world and how this might have an impact on us. So we know that our thoughts and our feelings are really closely connected. And once we start to pay attention to them, we can begin to notice those kind of habitual or maybe negative thoughts that that might come into our heads over and over again, for example, to a sensation in our body or a pain or discomfort. So when we notice our reactions to that, we can start to make a choice about how we would like to respond to situations rather than reacting in the usual way. So mindfulness is for all ages, it's for everybody. It's taught within a really wide range of contexts now, including in health, education, in your workplace, maybe in parenting, and through many different media. At the moment, it's obviously lots of it is online now because of the situation that we're in, but face-to-face, in groups or courses. There's lots of self-help books. There's lots of apps. I'm going to share a few of those with you a little bit later on to get you started. But the core practices are quite similar regardless. They include meditation in stillness, which we're going to try a little bit later on this morning, as well as movement. So you can be mindful when you're moving, you can be mindful when you're doing your everyday activities. It's just about being open-minded and curious to what's here. So it might be noticing your breathing, for example, and that's a really good way to start, by really paying attention to your breathing. But it might be really noticing sounds, or say being out for a walk and noticing birds in the trees or the colour of the leaves or whatever it might be. So this is kind of to the everyday and our usual sort of automatic experiences of moving. Maybe our automatic experiences of eating, washing, all the things that we do those without thinking. So this is about really sort of beginning to notice what we do and how we feel. So anyone can do it, although it has got its origins years ago in Buddhism, going back thousands of years. It's now taught in an entirely secular way, so it's got no religious context. So regardless of religion or beliefs, you can still practice mindfulness. As I said, it could be something really simple, like just taking a few breaths, or really tuning into or bringing awareness to a moment in our day. Mindfulness is evidence-based, and both science and experience so far demonstrate its really positive benefits for our health and happiness, as well as our ability to concentrate and build good relationships and things like that. So over time, those who practice mindfulness regularly report that they can learn to focus their attention and accept things in a more kind of open-minded way rather than a judgmental way. So noticing the prejudgments that we have on our experience as well. And they come to see thoughts as mental events. So sometimes our thoughts can really impact the way we feel. But mindfulness allows us to notice our thoughts and see them simply as mental events that can come and go. And we have a choice then whether we jump on board with those thoughts or not. And this really helps us to step out of what we might call autopilot, including those thoughts and worries that we're already experiencing all the time. More recent developments in neuroscience have demonstrated the structure and function of our brain is by no means fixed in childhood now. We used to think years ago that our brain was developed by about the age of 5 and there weren't any changes. Now we know that our brains remain neuroplastic and they can change throughout our lives. I'm going to share some really interesting studies on brain imaging around mindfulness with you in a moment. But the MRI studies have really shown the impact of mindfulness, and they suggest that meditation can profoundly alter the structure and function of our brain to improve both thought and feeling, to improve the quality of our thoughts and our feelings. It appears to actually reshape our neural pathways. So it kind of increases the density and the complexity of connections in areas associated with cognitive abilities such as attention and self-awareness, and also emotional areas connected with kindness and compassion and rationality. But it also, at the same time, decreases activity and growth in those areas involved with anxiety. So it helps us to keep our anxiety at bay and be able to rationalise our thoughts a little bit better. So I have got some sort of references and things. If anyone's interested, I can share those with you at the end on some reading of things. And I'm going to talk a little bit more about brain in a moment. But first of all, let's think a little bit more about this idea of present moment awareness. I don't know about you, but I certainly have opened a packet of sweets and to have one and then realised that they've all gone. Or maybe, and some of you might be able to relate to that, or maybe some of you can relate to the idea of driving home or driving somewhere and arriving there and not actually remembering the journey. If you can, that's what we would call sort of being on automatic pilot. And we're just kind of behaving mechanically, sort of without really thinking or being aware of what's going on around us. So in automatic pilot, it's almost as though our body is doing one thing whilst our mind is doing something completely different. Our mind can be completely preoccupied. And we don't mean to be that way necessarily, but it somehow or other just seems to happen. So our minds are quite passive a lot of the time, which allows us then to get caught up in thinking. We might be ruminating, thinking about things that have happened in the past and going over and over and over them again, or worrying, perhaps worrying about things in the future. Our minds get caught up in memories, in feelings, in plans, all kinds of things. And that's what our minds are actually meant to do. They're busy things. And so if we're replaying the past, or if we're sort of anticipating the future, this can be happening all the time when we're carrying out ordinary day-to-day tasks, such as driving or eating, or even in the working that we're doing. So most of the time, we aren't really aware that this is happening. But the split between acting in the present and thinking in the past or the future can actually lead to a sense of disharmony in us, especially where chronic illness is involved, because it's really easy to ruminate on negative health issues, or what we've been told, or how we might be feeling, or what happened before in an experience. And it's also really easy for us to worry about the future and what that might hold in terms of prognosis or treatment, or even the what ifs, So in mindfulness, then, we teach ourselves to recognize these moments when we're running on autopilot and intentionally place our awareness in something else. So by doing that, we kind of step out of autopilot and into the present moment. So by doing that, we're not thinking about the past or the future, we're just thinking about this moment right now. So a great way of doing this is to bring your focus of attention to yourself. And as I said, we're going to have a little practice in a few minutes. And that is all about bringing attention to yourself. So noticing your thinking patterns, maybe focusing on your body, noticing what sensations are there. And that's a great way of sort of stepping into the present moment. But before we do that, there are some suggested attitudes for mindfulness. So if it's possible to approach mindfulness with a non-judging attitude. So notice any thoughts you might have about it beforehand. You might already have a thought about what you think mindfulness is, or whether it will help you or not. So seeing if it's possible to be really open-minded before you start. People's expectations about meditation often can hinder their experience of the process. So rather than expecting a huge change or something amazing to happen the first time you do it, being receptive to what's happening, just noticing what's happening, even if it doesn't really feel like much. We'll suggest that you keep at it. It's something that is really helpful if you can do it regularly, because it has a cumulative effect. So the benefits will sort of build up over time. And being kind to yourself is really important as well. Being mindful isn't about being distraction free. It's not about clearing our heads. It's about noticing when our minds are busy and wandering off, and just bringing it back to whatever it is that we might be focusing on in that moment. So it's about noticing the busyness and trying to focus on one small thing. And being with whatever is, whatever it is that we experience in that moment, can actually be quite liberating for us. So instead of struggling to get away from experiences that we find difficult, or trying to ignore a sensation or a pain and just power through, sometimes when we focus on it and practice being with them, it can be quite liberating for us. And have patience. It might take a while to get into. It might not feel immediate, but it only needs to be a few minutes each day. So I'm not suggesting that you have to find an hour a day in a silent, dark room where you have to lay down and meditate or sit and meditate. It could just be a few minutes each day of noticing the moment that you're in. And when we suggest beginner's mind, meaning that sort of with beginner's mind, there are many possibilities. You might discover something new each time. So if you approach it each time with a fresh mind, you might discover something new. Don't assume that you already know how your experience is going to be. Trust yourself and don't strive for the experience you expect. Don't set out with any kind of aim, just see what happens. And letting go of thoughts and difficult emotions, and acceptance is really important too. So that's a little bit about mindfulness in general, sort of a real whistle stop on that. But I would like to focus just for a few minutes a little bit more on how mindfulness particularly helps with chronic pain and illness, because there have been many studies done on the benefits of mindfulness with chronic illness and pain. And there's one study that I'm going to talk about in particular, a study in America. It was shown to reduce chronic pain by up to 57%, with really accomplished meditators achieving pain reduction rates of almost 90%. So it can have huge benefits once you accept the idea of practicing mindfulness. And it can actually be prescribed now. So NICE, which is the National Institute for Health and Clinical Excellence, have actually approved its treatment now on the NHS. So I think depending on where you are, you can actually get mindfulness prescribed for you. And it's used as a treatment for all kinds of different illnesses, such as arthritis, cancer, chronic fatigue, diabetes, heart disease, MS. Lots of conditions are actually prescribed mindfulness now, because the benefits are really beginning to become known. As a treatment, it's actually quite unique, because it's not directing us towards being different from how we already are. Instead, it kind of teaches people to be present with whatever's happening, no matter what it is, good or bad. And this can be incredibly beneficial for people with chronic health issues. Sometimes there's not much we can do about the situation we're in terms of our illness. But what we can do is learn to accept it and help ourselves in that way. So in 1979, it's quite a few years ago now, a new clinical program called mindfulness-based stress reduction was introduced in a medical center in America, in Massachusetts. In a new branch of medicine then called behavioural medicine. So mental and emotional factors, the way we think and the way we behave, we know can have a significant effect, for better or worse, on our physical health. We know that now. And our capacity to recover from illness or injury, even if we have sort of chronic illness or chronic pain conditions and stress. But now we know that mindfulness goes beyond treating sort of psychological illnesses related to chronic illness. It's not just about getting us to think differently and feel differently about it. Because with the benefits of the new sort of ability to sort of image brains, so brain imaging reveals that mindfulness practice leads to actual alterations in the brain structure, which I alluded to earlier, which means that in actual fact, practicing mindfulness can almost rewire our brains in a positive way. There's an actual neurological process at work which kind of leads to people experiencing less pain generally. And it can also affect the production of chemicals which affect our mood, so helping us produce those feel-good hormones and chemicals. So thinking about the changes in the brain then, scientists have used MRI scans to see how brain changes when people practice mindfulness. It suggests that particular areas of the brain may either shrink or grow in response to a regular mindfulness practice. So research shows that after practicing mindfulness, the grey matter in your brain's amygdala, which is the region in our brain known for its role in stress, can actually become smaller. So that actually can be shown, that sort of area actually shrinks down. And the prefrontal cortex, which is the area of your brain responsible for things like planning, problem solving, and also for controlling emotions, the grey matter in this area becomes thicker after practicing mindfulness. So showing sort of increased activity in these areas of thought. So we don't feel quite so stressed about it. We're able to think about it and rationalise things in a more productive way. So these are just specific areas of the brain, but in reality, the different areas of the brain and body come together to work as a whole. So they communicate and they work together. A great example of this is how we experience pain and how mindfulness can change our experience of it. What we do know is that there's a link between how much pain we feel and our memories of pain. So when we feel a pain, so we feel a pain for the first time, our brain creates a memory of it. And then the next time, if we feel the same pain or a similar pain, our memory of that pain actually makes the pain feel worse. So if we're feeling a pain consistently, every time we feel it, it's feeling worse and we find it more difficult to tolerate. So one study found that people who practiced mindfulness reported feeling less pain than people who didn't. And interestingly, in these people, the areas of the brain associated with the pain didn't actually shrink. Instead, what happened was the areas of the brain associated with the emotion and the memory were less active. So that part of the brain, the memory part of the brain, became less active, enabling us to tolerate the pain better. So by not drawing on past memories of pain, they were almost able to feel less pain, if that makes sense. So I'm going to show you some pictures of the MRI, one of the MRI studies that was done. Now, in 2015, in the University of California, there was a study of a small group of healthy medical students. Now, these students attended 4 20-minute mindfulness training sessions, so 4 independent sessions of 20 minutes, just over an hour. Then what happened was they were given, or before that, they were given a pain. So they had a small thermal thermometer heated to 120 degrees, and it was applied to the back of their leg to actually give them pain. And the subjects then reported on that pain, and they reported the intensity and the unpleasantness of the pain. Then after their 4 20-minute sessions of mindfulness training, they reported a 40% decrease in pain intensity and a 57% reduction in pain unpleasantness. And it wasn't just their sort of interpretation or their perception of the pain that changed, it was the brain activity that changed too. So as we can see on these pictures of the MRI scans, when they experienced the heat stimulus, the pain under normal conditions, when they were just resting, the part of the cortex in their brain associated with that region of their body lit up there. As you can see on the left-hand side, sort of lit up with that sort of yellowy orange colour at the top there. But then after they were trained in these 4 sessions of mindfulness, the activity in the brain has gone right down, it's hardly detectable. So you can actually see the difference between experiencing pain when we're normally resting and experiencing pain after some sessions of meditation. If that's only 4 sessions of mindfulness, imagine the possibilities if we were to practice mindfulness regularly. The brain images also showed that meditation increased the activation in areas of the brain related to their cognitive control and emotion, as I mentioned earlier. That's where areas in the brain where our experience of pain is built. So there was a less activity there. If any of you are interested in investigating this further, there's actually a TEDx talk about this particular study that you can access on YouTube, and it's called A Different Approach to Pain Management, Mindfulness Meditation by Fadel Zidan, but I can send you the link or type that up for you afterwards if any of you are interested in watching that. That'd be quite interesting. So that's a little bit around the sort of neuroscience and what happens actually in our brains when we practice meditation. So it's not just about changing the way we respond and the way we react. There are actual changes happening in our brains to help us. So apart from all of that, we also know that mindfulness helps with anxiety and depression in general. It can help us to make better choices, because once we are able to notice our thoughts and our feelings and the connections between them, we're able to step back and decide, actually, how would I like to respond, rather than always reacting in the same way. Mindfulness generally helps our ability to cope, can improve our resilience, and also improve our sleep. So there are lots of ways you can be mindful. As I mentioned some of them earlier, meditation practices are fantastic if you would like to do that. But we can also just bring it into our everyday. So using our 5 senses to notice what we can see around us, noticing colours, noticing noticing what's happening around us. It could be around sounds, the things that we can hear, smells, tastes, everything. We can practice mindfulness when we're exercising. So as I said, it doesn't have to be sitting still or laying on the ground. It can be when we're walking, really noticing sensations of our feet on the ground, observing what's going on around us, listening to music, different hobbies such as painting, drawing, colouring, reading. I mean, there's lots of lovely mindfulness colouring books and that kind of thing around now, which are great, because you're really in the moment when you're doing that kind of thing. And also, silence can be really nourishing for us. Some of you may be able to sit in silence, but for lots of us, especially if we have busy lives, we have families, jobs, it can be really difficult to find a few moments of silence, and that can actually be really nourishing. And when we're sitting in silence and just becoming aware of our presence there, that can be really mindful too. The 8-week MBCT course or the mindfulness-based stress reduction course are really great ways to start to get a real mindfulness practice embedded. And that's where I started, and they're fantastic courses, and they go through every aspect of it over the course of 8 sessions. And there are lots of lovely apps. Some of you might have already heard of apps like Headspace and Calm, there's Smiling Mind and Aura. There's lots of lovely apps and things that you can tune into, and lots of books as well. So, just to say, really approaching this with a beginner's mind and being open of accepting of what's here, because sometimes we can have a bit of an opinion of something before we even know, really. Being kind to yourself is really important. Don't expect to be able to feel something amazing straight away or be able to do it straight away. It takes practice. So treating yourself with kindness and compassion and living life in the present moment, if that's at all possible. Know yourself. This is a way of getting to know yourself, really getting to know the way your body works and the way your thoughts are associated with feelings, not letting our illnesses define us, and enjoying the beauty of things as they are, rather than as you wish they were. That's what mindfulness is about, just accepting things as they are. If possible, surround yourself with people that love, support and inspire you, and let go of that life that you had planned. Accept the opportunities and hopefulness of the life that awaits you. And mindfulness is very much around accepting and letting go, which can be really powerful for us as we do that. So I hope I haven't talked too much. What I would really like to do now is invite you all to take part in a body scan practice with me, which is a fantastic mindfulness strategy. One of the first practices that I learned when I was coming to terms with my illness and my diagnosis, because it's a great way of practicing to explore sort of body sensations and thoughts at the same time. So in this practice, what will happen is you'll be invited, or I'll guide you through the practice. You'll be invited to move your attention around your body to just see what happens when you focus on different areas of your body intentionally. Again, approaching it with a beginner's mind so that you can see things as they really are rather than how you're expecting them to be. And just to mention that, you know, your mind will wander. Don't expect your mind to stay focused all the time. Your mind will wander off. But when you notice that it's wandered off, just see if it's possible to bring it back to the area of your body that we're focusing on. So I might be suggesting that you focus on a foot. If you notice that your mind has wandered off, you might be thinking about something that's happened earlier, or you might be thinking about what's coming next, or what you're doing this afternoon or this evening, or writing a shopping list, or whatever it might be. When you notice that, see if it's possible to bring your attention back to the focus that we're focusing on. Okay. So in this practice, we're going to use our body to ground ourselves. This helps alert us to our mood, helps us become aware of sensations, discomfort in our body. It also helps us become aware of how we think about them and how we feel about them. So sort of training ourselves to be able to shift our focus of attention as well, because we're going to be moving from body part to body part, if you like. And then noticing then how thoughts manifest themselves in sort of physical sensations. John, there's a person called John Kabat-Zinn, and I thought I would share some books with you when we do the question and answer section. He believes that when patients can detach themselves from their response to pain and focus on the actual physical sensations in their body, they can have a different response and suffer less with the pain. One of his books, which I thought I would share with you, is this great big fat one here called Full Catastrophe Living. I can give you the details of this later. It's a big fat book. This was particularly written for mindfulness for pain and illness, and it takes you through the whole program. And it's a fantastic book that he's written. So it's one that, if you wanted to have the book to read, this would be the one really that would be great for you. And one of the first practices in there that's suggested is this body scan strategy. Okay, so if you're happy to do this with me, I would suggest that you now get yourselves into a comfortable position. I'll just give you a minute or two to either lay down on the floor or sit back in your chair. Make sure that you're well supported and comfortable and warm, because it's going to be probably for the next half an hour or so. I will talk you through this mindfulness practice. Just give you a moment or two to get yourselves ready. If you can get yourselves into a quiet place where you can follow this practice. Maybe get a blanket if it's a bit chilly, pillow for your head if you're laying on the floor, or sitting back in your chair. And if you're sitting in your chair, we'll just suggest that you put your feet flat on the floor and support your back well. Okay, so I just want to give everyone a moment to make sure that you're in a comfortable position. Because I can't see you, I'll just give you a few minutes. Okay, we'll make a start then. So if you're laying down then, allowing your arms to rest comfortably by your side, and perhaps allowing your feet to fall gently apart. And if you're sitting in a chair, supporting your back, sitting in a nice upright position with your feet flat on the floor, so we can keep nice and grounded in this position. Close your eyes if it's comfortable for you to do so. If not, perhaps you could just lower your gaze to a point on the floor or the ceiling if you're looking up. And starting by feeling the connection of your body to the floor or to the chair right now, okay? So sensations of touch or pressure, perhaps in your back, your shoulders, or the backs of your legs and your heels of your feet, back of your head on the floor. Really feel where your body is touching the floor. And if you're in a chair, awareness of your feet on the floor, perhaps your bottom heavy on the chair and the lower half of your body really grounded in the chair. So noticing anywhere your body makes connection with the floor or the chair. And just to say, this isn't an exercise in relaxation necessarily, or any aim to feel any different. This might happen, in fact it usually does, but it might not. And if it doesn't, that's okay too. So remembering, just being accepting of what happens. So instead, the intention, as best as you can, to just bring your awareness to any sensations in each part of your body in turn, and I'll talk you through that. There's no right or wrong. So it's an exercise in noticing whatever is here right and now, just watching what's happening in your body with curiosity and with kindness to yourself. So let go of the tendency now to want things to be a certain way, or to be how we think they should be. Just see if it's possible to just let go of any expectation. Remember too, as I've already said, your mind will wander sooner or later, and that's okay. That's what our minds are supposed to do. But see if you can notice that it's wandered, acknowledge it, and bring it back to the part of the body that we're focusing on. Okay, so it's best to stay awake throughout this practice if you can, but you might feel sleepy. Sometimes people do fall asleep, so again, that's okay too. All right, so now bringing your attention to the sensations of the flow of your breath in your body. So see if it's possible to bring attention all the way down to your breath in your belly. As you breathe in, noticing your belly expanding, so the stretch and the rise of your abdomen as you breathe in. Notice the falling away and the sort of deflating as you breathe out. Not thinking about your breath, not trying to change your breath in any way, just simply notice those sensations of breathing in and breathing out. And you might find that you can notice the cool air in your nostrils as you breathe in. You might notice it's warmer as you breathe out. You might be able to feel it more in your throat or your mouth. Really tuning into your breathing as you breathe all the way down to your abdomen, feeling it expand and breathing all the way out. See if it's possible on the out breath to get a sense of letting go, feeling your body sink further into the floor or into the chair. Breathing out and letting go. Okay, so now when you're ready, I'd like you to move your focus of attention away from your breathing, down your left leg to your left foot and out to the toes in your left foot. So imagining your toes of your left foot and noticing whatever sensations might be there in your toes. So you don't need to make anything different. You don't need to move your toes. Just see if you can be aware of what's there. So maybe there's a sensation of contact with a sock or a shoe or slipper, or even the toe next to it. You might be able to notice a tingling or warmth, or even coldness. You might not be able to notice anything at all, and that's okay. Now see if you can sense the big toe, just the big toe. and the little toe. And then all the toes in between. So allowing whatever it is and really tuning into the sensation in your toes. And taking a nice deep breath in again, all the way in. And then as you breathe out, letting go of the attention around the toes and imagining sensations in your bottom of your left foot. So imagining your sole, your instep, your heel. Are there any sensations there? So you can breathe into this area, almost as though if you took a deep breath in, it could travel all the way down your body into your left leg and into this part of your foot. Then taking a deeper breath in again when you're ready, and as you breathe out, letting go and moving the focus of your attention to the top of your left foot and your ankle. So explore whatever is here. Skin, maybe, sensations of touch. Maybe you can even sense the joint. Focusing down onto those sensations in your foot, breathing in and breathing out. And then on an out breath, moving the focus of attention to the area of your left leg between the ankle and the knee. So there's your shin at the front and your calf at the back, and then the knee. And explore all the sensations that are already here in this region of your body. Can you sense your kneecap? Can you sense the back of your knee? And the sides of your knee? Now bringing the focus of attention upwards more to the thigh of your left leg. What sensations are here? So really being open to what you can feel in your thigh. Remembering, not prejudging, simply being with what is already here. Breathing into it, and breathing out, and letting go. Taking a nice deep breath in, and as you breathe out, you're going to bring the focus of attention now down your right leg, all the way down to your right foot and the toes on your right foot. Again, seeing what sensations you can feel. What sensations can you feel in your right foot? Can you feel your toes? Can you feel your big toe? Or your little toe? And the toes in between? Remembering now to bring your focus attention to the bottom of your foot. Your heels, the sole, the arch of your foot. And round to the top of the foot and the ankle. Noticing the skin and any sensations of touch there. It's just being open to whatever sensations you can feel. Okay, taking a deep breath in, and when you breathe out, letting go and becoming aware again of that area between your ankle and your knee on your right leg. Maybe the shin bone, calf muscle, breathing into it and out from it, giving it attention and allowing it as it is. Your knee now. What sensations can you feel in your knee? Can you sense your kneecap at the front? Can you feel the back of your knee? Or the sides? Letting yourself explore any sensations in your right leg and up to the thigh of your right leg now. Does it feel relaxed? Does the muscle feel heavy? Breathing in and breathing out and noticing your legs feeling heavy against the floor or the chair. Breathing in, and as you breathe out, letting go of sensation in your legs and drawing attention up now to your pelvis, your hips, your buttocks behind. Breathing right down into this region, remaining open to whatever sensations you might feel, whatever might be there. Moving your attention around and up into the back to focus attention in your lower back. And this is a part of the body that often holds tension and causes discomfort. So being kind to yourself now, letting your attention focus on this part of your body. Breathing into it and allowing yourself to notice what sensations are here. And if your mind has wandered, or your mind is wandering, see if it's possible to bring your focus attention back to your lower back. Not trying to make anything different, not trying to change anything, tuning into what you might find here. And then when you're ready, taking a deeper breath in, and on the out breath, begin to let go, focus on that area, and move on to the front of your body, your abdomen. So noticing you're breathing in your abdomen. So as you breathe in and out, the rise of your abdomen as you breathe in, falling away as you breathe out. Really feeling your breath filling up your abdomen as you're breathing. Breathing in and out, moving your attention up slightly now to the solar plexus area in the body, just below your rib cage. Noticing your rib cage opening and softening, allowing your breath to fill that whole area, exploring whatever sensations are here. And letting your focus attention expand now to the whole of your rib cage and chest. An area sometimes where we can feel sensations and emotion. So asking yourself, what sensations are here? What am I feeling at here? Allow things to be as they are, and what's here is here, and that's okay. Awareness of the movement as you breathe, the rib cage expanding on the in-breath and contracting with the out-breath. Now breathing in, breathing out and letting go of this area. Draw your attention to your upper back. So between your shoulder blades, your shoulders and your shoulder blades. Another area that often holds tension, tightness, discomfort. So opening really with curiosity to any sensations that are here. Exploring them and seeing what's here right now, whether there's tension there. Is anything in your body changing moment to moment, or is it staying the same? Just being aware of all of the feelings that you've experienced so far. So taking a deeper breath in, breathing into your back and shoulders, letting go as you breathe out. Bringing your attention all the way down to your hands now and your fingers and the fingers of both hands. So really tuning into your fingers now and any sensations that might be there. Again, sometimes we can feel warmth in our fingers or tingling sensations or sensations of touch. What can you feel in your fingers? Maybe you could focus right into your fingertips. Bring attention just to your thumbs. Expanding awareness to all of your fingers now, the sides, the backs, the fronts, all of your fingers. And even the palms of your hands. What can you feel here? Can you feel any sensations in the backs of your hands? Sometimes this can be a bit more difficult. What sensation are in the backs of your hands? Imagining that if you could breathe in and all the way down into your hands, how would that feel? Now expanding your focus of awareness up into your wrists and into your forearms and elbows. Moving up into your upper arms and shoulders. What can you notice here? Bringing into your focus of awareness the whole of your arms, both of your arms. How do you feel? Heavy by your side, perhaps relaxed in your lap, your shoulders down, relaxed. If you notice your mind is wandering, if there are distractions, see if it's possible to bring your focus and attention back to your arms. Taking a deeper breath in, letting go. Now moving the focus of your awareness to your neck. So the back of your neck, as you lay on the floor, or perhaps resting back on your chair, the front of your neck and the sides. What sensations are here? So thinking about the outside of your neck and the skin, but also the inside of your throat as you breathe, as you swallow. You can feel your breath as you breathe in and out. Moving your awareness now up into your face, your head. Starting with your lower jaw. Focus on the whole of your lower jaw, from the joint below your ears, all the way round to your chin and front. Now inside your mouth, perhaps you can get a sense of your teeth in your jaw. Gums, tongue, palate, back of your mouth, throat. And expanding your focus to the area around your mouth now, your lips, your nose, your nostrils. And see if you can bring awareness to the cool air as you breathe in your nostrils and slightly warm air as you breathe out. Side of your nose and your cheeks now. Cheeks out to your ears, side of your face and your ears. And including the region around your eyes, the area around your eyes, your eyelids, the eyebrows, your eyes themselves, eyelids, sockets, eyebrows. Notice whether there's any tension in your forehead between your eyebrows, whether you're relaxed. Maybe even bringing your focus down to the space between your eyebrows. Is that possible? And then your forehead. So being aware of the sensations in the front of the forehead and the temples at the side. So now holding in your awareness the whole of the mask of your face. imagine as you're breathing, imagine your breath refreshing the whole of your face. Now bringing awareness to your head. That's the top of your head, your scalp, your hair. Focusing in on that area. Okay, so expanding your awareness now to your body as a whole. So the whole of you as you lay here on the floor, the whole of you as you sit here in your chair, bringing your attention back to your whole body. Now imagining the whole of your body from the top of your head all the way down to the bottom of your feet. Just breathing in and breathing out. Almost feeling the waves of breathing in your body, accepting of everything that you've found here. Bringing your awareness to the whole of your body, breathing in, breathing out, just as you are right here, right now, in this moment. This is this moment. And allowing your body to be exactly as you find it. Whatever's here is okay. Acceptance of yourself as you are. Sense of peace as you sit here or lie here now. So before we finish then, just taking a couple more lovely deep breaths in, perhaps becoming aware of your surroundings and where you are in the room. Wiggling your fingers and toes, open your eyes. And when you're ready, let's open your eyes and sitting up. And hopefully most of you are still awake. So hopefully you enjoyed that practice. That's what we call the body scan strategy. It's one of the key practices for sort of helping us practice mindfulness, and one of the strategies that we suggested, if we can practice that regularly, that can be really beneficial. So thank you everyone for doing that with me. Over to you, Nikki.
Thank you, Sarah. I think just give everybody a couple of minutes just to come back to. I think, you know, I've known you for quite a while, Sarah, and I've had the pleasure and privilege of working with you on many occasions. And as I've said to you before, when you do something like that, I find it very, very difficult to stay awake. So I think that's good. You know me, so I think that's really great, and I hope everybody's really found that beneficial. It is certainly something that I'll be watching back when I am not working, so I can use that. And this will be available for our members on our website, members only, probably by the end of next week. So you know, you will be able to use that session again, which I think is really helpful to have something to follow. So thank you so much. And are you using acupressure mat, Ria, while you're doing the body scan? Okay, so again, that's like an additional thing.
Yeah, so you can notice a different sensation brings as well. That might be a good way of staying focused with that. And if you don't want to listen to my voice, but you want to have a go at the body scan again, there are some great body scans and some other practices that you can listen to. A really good place that I can recommend to you is the Oxford Mindfulness Centre website. It's just OMC, or Oxford Mindfulness Centre. And on there, they have a whole load of different practices that you can listen to for free. So there's some really, really good ones on there, so you can tune into that. There's also a link on that for young people. So there's some mindfulness practices and things on a different website. It will take you to a different website, but it's a link on there for practices for young people. So that's a really good resource.
Oh, lovely. Thank you. That's really useful. So I've had quite a few questions, so I'll just fire away, Sarah, if that's okay.
Okay, I'll do my best to answer.
So do you need, when you're doing the mindfulness practice, do you have to do those very deep breaths? As if, because some people suffer from bad congestion, and it can sort of set off a bit of a coughing fit or whatever it might do. The body scan's really helpful, but do you have to do those big deep breaths?
No, absolutely not. It's just a really nice, I find for me personally that it's quite a nice way of sort of letting go of something and moving on to another. So if you're taking a breath in, and then when you're breathing out, you kind of more able to let go. But the idea of mindfulness really is about observing. So if you can observe your breath, whatever it is, there's no need to change it. So absolutely, you can practice by just observing. So your breathing might be very shallow, or it might be quicker, or it might be slower. It's just about observing that. Just tune into it and observe it. So no need to do deep breaths or anything that makes you feel uncomfortable in any way.
Oh, really useful. Thank you. Are there any specific mindfulness exercises that are better for chronic pain than others, or is it a general?
Well, the body scan is one that was specifically developed for sort of chronic pain and illness, because it really helps us to tune into our bodies and our sensations in our bodies, but also tuning into our thoughts. Sometimes what we don't realise is that we might have a thought associated with a pain or a discomfort that might be causing us some anxiety or stress. So it's sort of tuning into our thoughts and tuning into our body. There's also some really nice movements. Actually, you can do mindful movement, and there's some really lovely gentle mindful movement activities that you can do. And if you were to do say for example you're going to do one of the courses, the 8-week courses, a couple of the weeks are around the gentle movements, which might be quite helpful. But you could probably find some of those on places like the Oxford Mindfulness Centre, or even on YouTube, and there's quite a few clips on there.
Lovely. Are there any particular ways to adapt mindfulness for people living with trauma? Or again, is it just the same sort of, is there something specific around that?
Yeah, there are. I didn't mention that today, and that's actually quite a sort of a complex area, but it's around noticing your thoughts and the feelings. Again, it's sort of where our thoughts and our feelings are connected. So trauma can actually change the way our brain is wired, as we know, and sometimes we might connect our thoughts and our feelings differently in that way. It's about finding a safe place, I suppose, in your practice that you can feel safe and secure in. So trusting yourself. There's a whole load of practices around turning towards the difficult. So things that are difficult for us, or might be difficult memories or difficult experiences or body sensations related to that. There's some practices around turning towards those difficulties, looking towards them rather than trying to avoid them, and trusting and knowing that you have a safe place in your own ability to retreat to if you need to. That sounds really sort of maybe sound a bit airy-fairy, but there actually is quite a lot around that. I haven't got anything to hand, but I could possibly find some reading or something around that if you'd like me to send that on to you.
Lovely, thank you. Thanks, Sarah. We've had sort of a few questions all around the same sort of topic. So these are sort of general ones. Many people, for whatever reason, can't sit still longer than maybe a minute. 2 minutes, might be pain, might be, they've got hypermobile, EDS, etc. Can you still remain mindful whilst moving?
Absolutely. There's a lot of mindfulness in movement. So you can do very basic movement mindfulness where you can really tune into sensations in your feet. So standing up and walking, feeling your weight shift as you move from foot to foot, really tuning into the sensations in your feet if that's what you want to do. But you can be mindful, as I mentioned earlier, you can be mindful when you're going out for a walk, or when you're out for a bike ride, or when you're eating, or whatever it is. It's just about instead of walking and thinking about everything that's going on, it's about walking and noticing what's going on around you, noticing how you're feeling, noticing the warmth of the sun on your skin, or the colours in the trees, or the birds' song. We can be mindful in any moment of our day. And actually, practices like the body scan are really beneficial, but it's also as beneficial to just be mindful for a minute a day, or 2 or 3 minutes if you can. So no, you don't have to sit still for long periods of time if that's too difficult for you. It's about bringing mindfulness into everyday things. So you could decide to practice mindfulness while you're cleaning your teeth, for example, really noticing how it feels on your gum, or how your teeth feel, or the sensation of toothpaste, or the smell. You know, you could bring it into everything that you do.
Thank you. One of the things that I noticed when I first started sort of trying to practice mindfulness many years ago, when it all sort of first started coming out, and we as practitioners were kind of looking at it, and I'm almost sure that there'll be at least a couple of people listening that will relate to this. When I first started doing mindfulness and started to do those few minutes of that sort of concentrating and being very mindful, I would find myself crying. And that's quite common, Sarah, isn't it? It's quite a common thing.
It is. It can really bring stuff up for us. You know, when we are sort of, for example, doing that body scan practice, we're really looking into ourselves. We're almost shutting everything else out. We're looking at how we feel and how we think. And we're really, once we really tune into ourselves, sometimes it can really bring emotions up. We sort of say, you know, be kind to yourself. It's important. And that's okay. You know, if it feels emotional, that's okay. Notice that. That's how this feels. No, it's all right. It's just about accepting whatever happens, really.
Yeah. I mean, often I would think I'm not even really sure what I'm crying about.
Yeah.
I just know it just felt very overpowering, whatever.
There's an emotion. Yeah, absolutely. Yeah, absolutely.
No. When you're doing mindfulness, is there a specific part of the brain that it's helping, or is it not helping the brain at all, or is there a biological effect?
Yeah, so it helps us to regulate our emotions really well. So the two parts of the brain that it seems to really impact are the prefrontal cortex at the front here and the amygdala. And that's associated with our reasoning and our thinking at the front here. It helps us to be able to reason things through and think things through. It makes things more logical for us. But it also helps the sort of emotions in the brain, in the amygdala, by helping us to be able to regulate those. And that, as the more we practice, the bigger this sort of thinking part becomes, the more dense this thinking part comes, and the more reduced that the emotional part comes. So we're able to respond more without reacting emotionally. So we might find that I certainly found when I was first diagnosed that quite often my pain or my symptoms would cause me anxiety. And I would preempt them and feel anxious, even if I didn't have them. And the minute I would feel something, I'd immediately think, oh, here we go again. It's going to be a terrible day. I'm not going to be able to do this or that. Or I'm going to feel bad again now. Once I started to practice mindfulness, I was able to notice the thought and the physical sensation connecting to each other. You know, sometimes the thought would come first and then I'd get the physical sensation. Sometimes I'd get the physical pain and then the thought. But mindfulness kind of allows you to almost step back a little bit and think, okay, yeah, that's what's happening and it's going to be okay, or it will pass, or what can I do to help myself, rather than automatically panicking, anxious about something.
Thank you. Is there a difference between mindfulness and meditation?
Different types of meditation there are. I would suggest that the practice that we just did was a mindful meditation. So yeah, I think there are different types of meditation. So there probably is a difference. You don't have to be mindful. You don't have to be meditating to be mindful. So you can practice mindfulness without meditating. It's just about noticing, tuning in, noticing, and being present. It's the difference.
And I think there's definitely something around, especially those of us with busy lives and families and jobs and everything else that's going on, it can feel very, very luxurious to even take 10 minutes out to be mindful, can't it?
It can feel a bit indulgent, can't it?
Indulgent, yeah.
And sometimes people say to me, well, I haven't got time to add this. You know, I've done some mindfulness courses with some teachers, whose immediate thought is, well, I haven't got time to start doing this, you know, I'm busy, I've got all of this going on. It doesn't necessarily have to be something new that you've got to find time to do something extra. I mean, great if you want to lay down and do a body scan or some, you know, whatever. There are lots of different mindfulness practices. That was just one. But as I said to you about the teeth cleaning, it could just be being mindful about something you already do. So we don't have to find extra time and lay down in a darkened room to do it, although that is lovely if we can. It could be just about really noticing when you eat, you know, looking at what you're about to eat, whatever it might be, really noticing it, noticing how it smells, really noticing the flavour, what happens in your mouth as you anticipate biting it. That could be a mindful thing as well when you're having lunch. So yes, it could be about just introducing it to your everyday activities.
Lovely. And then we've got loads of questions around, can we have your email? Can we have the book you suggested? How do we get the 8-week course? How do we, there's loads of that. So I was going to pop that into the all panelists and attendees. Can I pop your email address in here, Sarah, your
Yes.
well-being?
So it's Sarah at sarahbwellbeing.com. There is a website as well if you want to have a little look at that. It's just a little bit about me. So Sarah at sarahbwellbeing.com. That's the one. Yep. And this is the book. As I said to you, it's not light reading, but it is perfect for people with chronic illness and pain, and it talks through all of the courses. So yeah, it's John Kabat-Zinn, and it's called Full Catastrophe Living. You can get this from Amazon and places like that. Now, John Kabat-Zinn was the person that did the original study back in America, and he did this mindfulness course was actually developed for people with chronic illness and pain. That's what this mindfulness, the 8-week course was developed for. And that this book is a result of that. There are different editions. This is the second edition, the one that I've got now. So have a look out for that. I think it has been updated. So that's a really good book. There is another good book, this one, which is mindfulness-based cognitive therapy for depression. It does say for depression, but what it does is it talks you through the 8-week course. So it's almost a book that you could do if you were interested in sort of finding out about the 8-week course. It almost takes you through the 8-week program. And that's a good one. Can you see that?
Lovely. I've popped both links into the chat. So both of those book links, nice advert there for Amazon. Just made Bezos another £1 billion. But they're both in there. Both links are in there.
Yeah, as I say, they're quite heavy. They are quite heavy reading, but they're actually really useful reading. And certainly this one, you can dip in and out of and read bits that are relevant to you, and it is quite useful. And there's lots more different practices and lots of more sort of in-depth explanations about the practices and why they're good to do. And the 8-week course basically almost follows this sort of in this book. So if you're interested in that, you could have a look at that.
Lovely. And the 8-week course, should they just contact you and you'll signpost them or tell them about that? Is that the easiest way?
Yeah, I haven't got any booked at the moment, but I'm open to, you know, if we wanted to make a group up or something, we could do a group, or we could do something over Zoom. So I'm open to any of that really, if you're interested. Or we can do some one-to-one work. You know, we can even do the 8-week course one-to-one. Sometimes it's quite nice to do it with a few people because you sort of learn from each other a little bit as well. So
but do contact Sarah for that. And
yeah, absolutely.
It's more of a comment than a question. Somebody has said that she finds it very important to practice mindfulness regularly, not just when she needs it for pain or anxiety, because what she found was when she was doing it for that reason, she would associate practicing mindfulness with pain and anxiety, which would make it worse. So she's incorporated it into her daily routine. Yeah. Would you agree with that? Yeah.
Yeah, it's absolutely perfect. In actual fact, it's almost advisable to start practicing, you know, to do some mindfulness practice when you're feeling fine, when you're feeling able to cope. Because if we don't do any and then we try to do it when we're not feeling good or when we're feeling anxious or panicked or in pain, it can be really hard to stay focused and in the moment. So if we're practicing regularly, how to bring our attention back and how to stay focused when we actually need it, when we are feeling wobbly or when we're feeling in pain, when we need something, and it will be easier for us to just tune into that and do it. But yeah, practicing every day, regardless of how you're feeling, is really great.
It's one of the things that Sarah and I have a similar background. One of the things when I was working with young people, and they were having issues with anxiety, depression, pain, whatever it might be. One of the things I used to get them to do was to write messages of affirmation to themselves on their bathroom mirror using a lipstick. So with mum's permission, obviously, or dad's permission, but to write those messages of affirmation, like I am okay, today will be, I will get through today, those kinds of things. So whilst they were brushing their teeth, and to look at the words, and actually that's a form of sort of mindfulness, isn't it? They're concentrating on something positive.
Yeah. And the repetitive thing. And one of the things that really helped me when I did my original course was saying to myself, what's here is here and that's okay. Because the physical sensations that I was feeling associated with the illness caused me the anxiety, and the anxiety caused me to feel worse about them, which caused the pain to be worse, and it's just a kind of a snowball effect. If I was doing a body scan practice or a mindfulness practice and noticing the pains or the sensations, instead of feeling really upset about them, if I kind of said to myself, okay, that's that again, and that's okay. It is what it is, and that's okay. By saying that to myself, and I still say it to myself in my head quite often now, that has really helped me. Just helped me to be accepting. I can't change it. It is what it is, and that's okay.
Thank you.
It does help. It's really strange, and I wish I could explain it in a better way. It does help you to manage the pain. It really does.
I think you've explained it really well today, and I just have had a comment from Stephanie, she's absolutely correct. Please to remind people that most libraries have an app with ebooks and things, so you don't have to buy these books, you can borrow them. And they've got extended loans at the moment for people borrowing, so yeah, you don't have to buy them. Thank you for that reminder.
Also, to say there are lots of free resources. Have a look on things like the Oxford Mindfulness website. There's lots of resources on there. There's reading. There's lots of interesting articles and research. And there's lots of free practices that you can tune into. There's lots of free apps as well. Some of those apps that I mentioned, you can get those for free. I think some of them ask you to pay for more in-depth membership, but Headspace, Calm, Aura, there's a few of them that are really good free resources, and there's some stuff on YouTube as well. So yeah,
I've just popped the link up to the Oxford Mindfulness resource.
Yeah, and you can just Google Oxford Mindfulness and it takes you in. You have a look around the website. Some of it's for teachers and some of it's about becoming a teacher. That's where I did my training. But there's also stuff on there that you can access that's really helpful and informative.
Lovely. Well, Sarah, that just leaves me to say thank you so very much for your time today, and thank you to everybody for joining us. I know I always find it very interesting, all of these webinars. They say every day's a school day, and I think it's absolutely right. It's always good. And as somebody who's been around mindfulness for many years, I think it's always really good to be reminded as well, because I forget to do it. And I know that when I do practice my mindfulness, even if it is, I tend to do my brushing my teeth. When I do remember to do it every day, it certainly does have an impact on my day.
It does have an impact. But thank you so much for inviting me, and thank you everybody. I hope it's been sort of informative in some way or helpful in some way.